Inner ear infection treatment. Inner ear infections are rare but serious conditions that require prompt and aggressive treatment. If left untreated, the infection can progress rapidly and result in permanent hearing loss. This happens because, unlike the middle or outer ear, the inner ear has a minimal immune response, making it more vulnerable to damage. In severe cases, the infection can even spread beyond the inner ear to the brain, leading to life-threatening complications such as meningitis or brain abscesses. That's why doctors act fast with an aggressive approach for inner ear infection. First, they give high doses of antibiotics to quickly suppress the infection and stop it from spreading. Once the infection is under control, high doses of steroids are given to protect the remaining function of the ear and prevent further damage. Usually, during an inner ear infection, our body produces antibodies to fight the bacteria. However, these antibodies can sometimes affect the surrounding areas, which can result in a double-edged effect that can damage the inner ear itself. Steroids help calm down this reaction and protect the ear. Depending on how bad the hearing loss is, doctors might suggest other treatment options like: if the hearing loss exceeds 80%, a cochlear implant is typically recommended to restore hearing. For hearing loss less than 75%, a hearing aid might be recommended. However, even if hearing loss is mild, around 20%, if new bone formation begins around the inner ear, cochlear implant surgery may need to be performed as an emergency. Wonder why this new bone forms? Well, our body forms this protective bone as a defensive mechanism around the inner ear, to contain the infection and not let it spread to adjacent structures like the brain. However, if the bone fully forms, the ear becomes non-functional. In other words, the ear will be useless, resulting in complete hearing loss that cannot be restored even with a cochlear implant or any other procedure. Therefore, a cochlear implant surgery is performed as an emergency action to preserve the ear, when the bone formation is just starting. Once the bone formation starts, nothing can stop it. Even fixing the infection or any medicine cannot stop it. Additionally, it is essential to identify the root cause of inner ear infection. It is mostly a middle ear infection, and very rarely an infection in the brain. The middle ear infection is also secondary, so identifying its root cause is also necessary. So, although once the infection reaches the inner ear, it is considered serious. Not just curbing the infection in the inner ear is important, but also fixing the underlying cause and preventing the recurrence of any infection is important. To know more, please read our article, Inner Ear Infection Causes, Symptoms, and Treatment. Link in the description. Stay healthy. Stay happy.